Okay, this is Michael from Blue Sky Bio. I'd like to take this opportunity to welcome everybody who's joining us for this webinar presentation. In India, it's the evening time. In the United States, it's more of the morning time. Wherever you're logging in from, thank you for taking the time to join us for today's presentation. This is really the first time that Blue Sky Bio is organizing webinar presentations specifically for countries outside of the United States. It's very exciting for us to be part of this. I also wanted to thank Image 3D Conversion for helping organize this. And we have several other upcoming presentations specifically directed for other countries as well. And they're going to be taking place in the relevant language as well. So this is all part of the Blue Sky Bio 2017 web series on various topics connected to guided surgery and implant placement. As I mentioned, this presentation is organized by image3dconversion.com. They're a great resource in India for providing computer-guided products and services. I've heard a lot of great feedback from international users as well who have benefited from the products and services. Technical note, if you have questions during the presentation, then you could type them into the chat box next to the video screen, and we'll try to address them during the presentation. And I've entered into the chat box a link for the webinar attendance form. Please put your information in there as well so we could send you the relevant CE credits. Tonight, or this morning, we have the honor of hearing from Dr. Jaju. In addition to practicing dentistry, he's a key opinion leader, Director of Oral Imaging Solutions, Chief Radiologist at Dia Dental Imaging. He has published many papers and textbooks and has an impressive list of presentations and awards, and is a highly recognized presenter and lecturer. And of course, an avid user of BlueSkyPlan, an opinion leader and contributor. I'd like to go ahead now and introduce Dr. Jaju for the presentation.
Yeah, thank you, Michael. Should I start?
Yes, please go ahead and start.
Yeah, good evening, all the people who have joined from India, and good morning to all the dentists who have joined from US and abroad. I'm myself Dr. Prashant Jaju, and I'm an associate professor and guide in India, and a keen interest in CBCT and in guided surgery. Now, today's topic is an interesting topic and a relevant topic: digital workflow, guided surgery through Blue Sky Bio. Now, just a brief overview Michael has given it. I just show this screen tells us the about myself. I started practicing as a radiologist from 2009 after my post-graduation in maxillofacial radiology, and one of the earlier pioneers in India to start a CBCT center. Since then, I've been associated with image 3D conversion, and we have done some interesting cases and looking forward to work more with them. I have published 2 books. One book is exclusively on CBCT, and we also have an exclusive CBCT magazine, which is circulated worldwide in the soft copy format. This presentation, obviously, as Michael said, is brought to you by Image 3D Conversion with the Blue Sky Bio. Now, there's a long history and a very relevant history of Blue Sky Bio, which is established in 1998, and it is basically a free guided surgery software as BlueSkyPlan in 2009. Dentists are using this software as an advanced tool to review and analyze all possible consideration and doing a virtual implant planning to select the implant site to place an ideal implant before they go for the advanced surgery. Along with this, Blue Sky Bio also have other options which are available, and they are very interesting options like the manipulation of CT or CBCT scans, generation of STL files for surgical guides, for fabrication, anatomical models, surfacing, offsetting, and much more options. Blue Sky Bio is available in almost 7 languages. It's one of the only software which is totally free, and you don't have to pay any charge for this. Otherwise, there are hell of a charging for a third-party software or planning software. And it is also a software which allows us to fabricate surgical guides for all implant system and drills. A brief overview for Image 3D Conversion, which is one of the distributor for surgical guides for Blue Sky Bio in India. It's an authorized software trainer and a service provider, and it has people who are working working CAD-CAM professionals working since last 8 years in digital dentistry and providing services to international as well as national clinicians for computer-guided implantology practice. This company is engaged in offering services in digital implant planning to produce computer-assisted surgical guide with help of various experienced professionals and helping dentists worldwide to enhance their knowledge in medical software for computer-guided implantology. So let's start with a very interesting and relevant topic, computer-guided implantology, a digital platform for implant surgery. So we all know we have used Cbct scans and CT scans. We all know that when the scans we take, the scan doesn't give you the precise location when we see in the oral cavity. So we need something which will guide us properly and help us to do the implant surgery. So this gave rise to the computer-guided implant surgery, where it uses a CT or a Cbct scanner. Along with that, it uses a guided software, so that a clinician can virtually 3D plan the treatment plan for placing the implant according to the patient's anatomical, structural, and the prosthetic need. He can select the type and the size of the implant system, its relevant position within the bone, and its relationship to the planned restoration and adjacent teeth or implants before actually doing the 3D surgery. Now, this is very nice because this reduces the armamentarium for the clinician when he actually does planning to do a surgery, because everything is planned on the screen precisely at the precise location. So once the guide comes, you're just supposed to follow the protocols and place the implant with quite certainty that the chances of error are minimal. The surgical drill guide is fabricated by a process of stereolithography. And after this process, which is used by clinician to place the planned implant in a correct position. What are the benefits from a normal implant plan, a surgery, and a computer-guided implantology? Now, implant-guided dental implant surgery have a great amount of accuracy and safety than the traditional implant surgeries. As I said, you were doing the entire virtual planning on the computer screen itself before an actual surgery is provided. So it is a faster and more comfortable procedure to place an implant with minimum complication. It is quicker and it has easier recoveries. So it is more precise, less invasive than the actual implant surgery, and post-operative complications like pain, swelling, bruising, discomfort after surgery for patients, and small incisions means a faster healing time. So what are computer-guided surgical guides? Surgical guides are appliances that are designed and fabricated for an accurate glazing by a process called stereolithography. And the surgical guide contains steel sleeves with a predefined diameter to guide the drills during osteotomy process. Now, there are various types of surgical guides, like a pilot guide, which will allow the clinician to create an initial osteotomy, and after the pilot osteotomy is created, the dentist can just remove the guide and the rest of the process is done free-handed. Excuse me, can you hear me?
Yes, we hear you just fine.
Yeah, it's fine, right? Okay. Other guides are not from pilot drill, but they help you for the entire osteotomy, for the entire drill sequence. Only after the entire drill sequence is performed, you just remove the guide and then you place the implant. Implant cannot be placed with guide in position. Some protocols include depth control systems that allow the surgeon to control vertical preparation by using a stopper or a sleeve so that you cannot over-penetrate the bone. In addition, surgical guides can also be classified or categorized depending upon the stabilization they take, whether they take it from the teeth, the bone, or the soft tissue. Now the question arises, when and how are you going to use the surgical guides? Well, the basic indications for surgical guides includes whenever you're planning 3 or more implants in a row, because your parallelism is important. Whenever you feel you're very close to critical anatomical structures, be it maxillary sinus in maxillary posterior region or a mandibular canal in the mandibular posterior region. When the dentist or clinician feels there's a problem related to proximity with the adjacent teeth. When you have a very questionable bone volume and you have to be very precise in your surgery to place an implant. Implant position, which is very critical for your prosthetic need or for a planned restoration. That time surgical guide could be a very useful technology or technique. Flapless implant surgery, it's nowadays very much in demand because it results in immediate quick surgery as well as minimal post-operative complications. And lastly, whenever full mouth rehab is planned with or without extraction, surgical guide has to be advised. Now, before surgical guides or computer-guided surgical guides were in proposition, we had certain conventional methods which were called as radiographic templates, which were later on sometimes used as surgical stents also. Now, these were fabricated from vacuum shells with either buccal or parietal or lingual facing of planned restorations, or more complex with 2 mm drill holes or metal tubes. But there was a lack of correlation in these appliances between the planned final restoration and the underlying bone anatomy. But with the use of computer-guided implant surgical guides, this has been eliminated, and we can precisely now plan the implant position before actually going for surgery. Now, various traditional methods were used initially, like the gutta perca, which is used in the routine clinical practice, barium sulfate, lead foils, which have been used for fabricating radiographic templates and gradually using as surgical guides. But bone and soft tissue loss from periodontal disease and atrophy of bone, long-term use of denture, and pneumatization of the sinus has made it difficult to predictably use these traditional surgical guides, and the failure rates are much, much higher. Now, this slide shows you some pictures of traditional radiographic templates which were used here, like a stent with the gutta perca marker, which are having a clear acrylic, and the dentist used to place the GP wherever he wished to, wanted to place the implant. The other picture, which shows a virtual anatomy, which is a 3D reconstructed model, is of a dentist who used to use a lead foils. Now, this was a very critical technique which he used to do. Before planning an implant, he used to open up the flap and place the lead foils. Then he used to suture the flap and advise the patient to go for a CT or a Cbct scan. Once that scan would have been done, then we used to do the planning. And after the planning, again, the dentist then used to again open up the flap and then used to place the implant. So very crude method and not a realistic method, because he's exposing the patient twice or thrice for the surgery. Third one is now again the 3D reconstructing the mandibular incisors, where again a GP marker has been placed to place the implant. These techniques, it is possible to place the implant position, to identify the position of the implant, but the depth control or the mesiodistal control of your drill or the implant placement is not possible with these conventional modalities. So for a successful guided implant surgery, we require two things. One is a CBCT, where we require the DICOM files, and an advanced guided implant surgery. So let's see how the marriage of these two technology can work, CBCT and advanced guided softwares. CBCT, well, the abbreviation stands for Cone Beam Computed Tomography, has actually created a revolution in digital dentistry. It was introduced way back in 1999 in Italy. It was by Newton. And since then, almost more than 35 manufacturers are there worldwide producing CBCT machines. With even the Asian market where I am, is day by day we are seeing more and more CBCT units coming up in most of the clinical direct diagnostic centers and in private clinics. The name comes from the beam type of beam which is emitting out from the machine, and that is a cone-shaped beam, and that is why the name is it has been named as Cone Beam Computed Tomography. Now, how is it different from the conventional spiral CT or the medical CT? In the conventional spiral or medical CT, the beam is a fan-shaped beam, so the area or the coverage is much broader, as opposed to a cone-shaped beam which has a limited coverage. So the advantage for patient is that the radiation dose delivered is significantly low in cone beam CT as opposed to a fan beam CT. So once a CBCT scan is done, we require another aspect, and that is our implant guided software for dental purpose. So what is this software going to help us? First and foremost, it should allow the import of features for medical scan like CBCT or CT for analysis. The software should allow digital models or appliances which are being scanned to again be imported into this. It should allow the dentist or the clinician to do segmentation and create a three-dimensional volume of the patient's anatomy. Tracing of and identifying inferior alveolar nerve canal is very critical for especially edentulous mandible and in patients who are osteoporotics, where the identification of mandibular canal is very crucial. There should be a pre-installed library which will allow the dentist to utilize that library according to his requirement of the implant system, his requirement of the abutment and creation of virtual tooth. And measurement of implant planning has to be done along with the information of bone density. And last but not the least, designing and planning of surgical guide digitally. And if you look at all these aspects and points, BlueSkyBio is one of the software which offers you everything in this. And the biggest advantage, as I said, it is completely free of cost. So how is the workflow? It's an interesting and very easy workflow, not a complicated one. As I said, we require two things. One, we require a DICOM file from a patient's Cbct scan and a Cbct impression of the patient's cast or model. Then you integrate these two things in your BlueSkyBio plan software, where a treatment plan has been done, like image 3D conversion does it for us. Then we fabricate the surgical guide on this treatment plan, and finally, once the guide is ready, the dentist or the clinician is ready to place the implant properly, accurately. So what is the initial data required for planning? The two things, as I said, if it's an edentulous patient, we require to create a scan of patient having a denture in his mouth, a conventional routine denture, which is the prosthetic dentist is planning for him, with a fiduciary marker, and the scan of the denture along with the markers. Then we need to export both this file in DICOM format, that is the Cbct scan and the dual scan. This is one method. The other method, you place a radiographic marker on a plastic tray with a routine alginate impression, the plastic tray, and then scan the patient with this impression. Scan the impression again and export both the files with DICOM format. Now you must be aware of this terminology called as DICOM. It's a standard imaging format which is used routinely and for Cbct formats as well as for creating STL file creation. If it is an edentulous patient, the protocol is slightly different, not much different, but slightly different. You do a Cbct scan of the patient, then you do a Cbct scan of patient impression on a plastic tray, or you can scan the stone model. Again, the file is exported in a DICOM format. Now this is a pictorial representation of a Cbct scan of a patient with impression and the Cbct scan of the impression only. Now first step is done now. Now we come down to the second step. Now the second step is we have two things. The patient scan is with us. We have the optical scan of the impression, both of them. And both are now imported in the BlueSkyPlan software. Now BlueSkyPlan software has various tools which will now help us to merge this data of Cbct as well as the optical data with using referring points, so that the referring points will allow a precise overlapping of both the technique, both the volumes, the hard Cbct model volume as well as the optical data volume. So these the red dots which you are observing on both the slides, both the pictures, are the referring marks which have been marked precisely at the same points, which will allow a superimposition of both these structures. And an optical STL scan is stitched. Stitching can also be done with the fiduciary markers which is there. So you have the markers on the which is radio opaque, be it barium markers or there are fiduciary markers inside the radiographic templates itself. Then they are merged with the CT model, and finally patient CT and impression is stitched. Now the question again, someone will ask me, is it the dual scan we require every time? And if it's not, then when it is the indication for the using the dual scan. Now what is the scan appliance and when it should be used? A dual scan contains multiple DICOM of scan appliances with radiographic markers, or which is called a fiducial markers, and it is acquired as a process of a Cbct scan. This scan appliance is nothing but a rigid acrylic appliance which fits over the existing teeth or a tissue. And this file is utilized to create and design surgical guides. Now, when is this required? Basically, it is not required in all the cases. It is required only in cases which involves less than 5 teeth and presence of multiple metallic restorations, which would result in scattering of the CT scan image. We all know the CT scan degrades the image quality whenever the patient has prosthetic crowns. But there are certain things which we should consider before going for a dual scan, especially if the patient is edentulous, if the metal restoration presence is there in the CT scan, and if patient is having less than 4 to 5 teeth. Now, what is the optical scan, which is already discussed, and when is we required this optical scan? Now, we need to scan the patient's teeth optically to fabricate the custom surgical guide. But you have to understand, the CT data is a hard tissue data. It is accurate for planning, virtual implant planning, but not for guide fabrication. We require, for guide fabrication, we require the hard tissue as well as the soft tissue. So the optical scan of the teeth and model of the teeth is merged with the CT scan using BlueSkyPlan software, which will allow even the soft tissue, the gingiva, the data could be acquired by this. The implant is planned using CT data, but the guide is planned and designed with optical, which is much more accurate and much more precise. The optical scan comes in stereolithographic format, which I said is STL format, which is required for the 3D printers. This format represents a 3-dimensional object model of an object, and we need to convert this scan into an STL format to import the file into our software optically. So in the screen, we can clearly see the 3D model where implants is virtually placed accurately. And different windows allow us to manipulate and to position the implant perfectly until the dentist is happy with the prosthetic requirement. You can also adjust the angulation and the mesodistal placement of the implants. As I said in the earlier part, BlueSkyBio is a free software, but along that, one of the requirements of any third-party software is a predetermined implant library, which is there in this BlueSkyPlan software. So where any implant system can be used. You can even customize your implants with your relevant diameter and the relevant length of the implant. It allows 3D rendering of the volume which is acquired, and various color tools could be utilized. So, and we at the same time we can do segmentation. So with beautiful segmentation techniques, we can much more accurately plan these things and plan the surgical guides. Nerve tracing is possible with this. And with this, even while doing the nerve tracing, your implant position can be accurately and precisely placed. And finally, once we have the CT data, we have the DICOM optical data, we can now design the surgical guide. And this surgical guide will help us to determine the osteotomy procedure and predetermine the depth as well as the angle control. The surgical tools on this BlueSkyPlan software helps the clinician to fabricate all types of guides, which is not there in every software. Mind it. It allows it to fabricate a tooth-supported guide, a bone-supported guide, and a tissue-supported guide. With BlueSkyPlan bioscan software, surgical guides can be customized based on any guided drills available in the market, be it a reputed company or a local designed implant system. That's why the BlueSkyPlan is easily called as a universal compatible guide. Once the guide is created, the drilling protocols are followed, and data is exported into STL file and then sent to the image 3D conversion, where to be doing in India to fabricate guide for us. Now, a guided surgery has a different surgical kit, and as opposed to a conventional implant surgical kit. And this IDC, the image 3D conversion drill guides, is a universal guide system, drilling system that is designed and planned by highly experienced professionals using rapid prototyping technology, where guide is compatible with any implant system or any drill kit. I'm stressing on this aspect of universal guide kit more regularly now in my presentation, because the dentist need not buy a specific implant system drill kit or a surgical guide kit. This one system drill guide kit is sufficient for all the implant systems worldwide which is regularly used. Treatment plan can be requested to the image 3D conversion technician who would plan your osteotomy for behalf of you, or you can do it on yourself. The choice is with you. The Cbct data they offer can be sent online or in a CD format. and then the team of the concerned dentist or the technician will interact with the dentist, get his approval before fabricating the guide. The charges, as this is an Indian currency, and it is almost 3,000 rupees in the Indian currency. I think it should be less than $50 dollars. Now they are presenting one case. This case is done by Dr. Corey Glenn, where we have done a Cbct volume as well as an optical scan, which was then sent to the image 3D conversion, and a virtual implant planning was done. His approval was done, and you can see the final implant placement which is done. So the post-operative results is perfect. And if you look at the virtual implant planning, it is, and the post-op picture, they are precisely there where it was actually planned. Now this is another the continuation of the same case where the surgical guide which has been fabricated, segmentation has been done, and you can see even the drill depth, the drill keys, the depth of the osteotomy, the angulation, everything is predetermined so that the post-operative complications are minimized. So it is basically a tooth-supported surgical guide which was designed. This is my case where we, at my imaging center, we had done this case in India, where the dentist was the patient which we had a very poor ridge and a highly irregular mandibular ridge. So it was when we did an initial CBCT scan and done the planning with BlueSkyPlan software, we realized that it was only possible to place 4 implants. So we did, and the mucosa were also a bit firm to use a mucosa supported guide. So with advice from the image 3D conversion team, we went ahead and did a bone supported guide. The implant system which they used was Alpha Biodent, and this was a fully edentulous case. The next case is from Dr. Rahul. This is from Pratim from Guwahati. Again, this case was guide was fabricated in image 3D conversion, and the entire planning and osteotomy was done on BlueSkyBio software. They used an add-in implant system with a screw retain restoration. Again, wonderful planning done and wonderful results where the dentist and the patients were happy. So coming to the end of the presentation, it had been as I said, guided surgery is the future for implant dentistry. I just want to add one more thing. I am quoting from one of the reputed dental clinics of North America on CBCT, where there in the computer guided surgery part, they have mentioned that the research has been going on checking how much error is happening when a dentist is doing guided surgery. And the results which has come up is quite astonishing. They have said that the error is just 3 to 5 degrees. Not much of tilt is happening when the actual guided surgery is there. So that's a pretty good success rate. And I think we are gonna, with more and more software coming up, more and more planning accuracy coming up, and more accurate 3D printers coming up, I think the surgical errors or the error for coming from guided surgery is going to reduce significantly. So this is the future, the guided surgery, and this is what we have to learn, and we have to practice it in our implant practice that is there. If you wish to learn the BlueSkyPlan software, you want to design surgical guides, you want to plan surgical guide, or you want to send cases for fabrication of surgical guide and do computer guided surgery, this is the address as image 3D conversion and the relevant telephone numbers. Also, BlueSkyPlan will provide a certified professional program, a 3-day full day program, and which is I think very important. If you're using a BlueSkyBio software, any software, you should always understand the software, and you should utilize the software in all its format. So if you know the intricacies of the software, you would be able to handle the software much easier. So I'll always advise BlueSkyBio certified professional training program, a 3-day program, which you should attend, and you should get yourself registered. Thank you, and it has been a great opportunity for me to present this presentation in front of all of you all. And if you have any questions, I would be more than happy to answer. Thank you.
Okay. If anybody has additional questions, some questions have come in already. If you have additional questions, you could type them in the chat box next to the video screen. So a question was asked earlier, have you found that guided surgery significantly reduces patient time in the chair?
Yeah, Michael.
Yes, did you hear the question?
Yeah. See, when I said it reduces the time, is my actual meaning is, initially when the guided surgery was not there, the dentist, when he used to do implant planning on the computer screen before the advent of CBCT, he used to just, based on the clinical examination, based on the panoramic radiographic examination, he used to get a rough estimate how much height of the implant he can place. Obviously, the depth would be difficult to determine. So he used to advise implants 1 mm extra, 1 mm centimeter less. So the number of implant system and armamentarium used to be much more. It would have been spread out on his surgical table. But with CBCT and now with computer guided surgery, a 3D planning is done on the computer screen beforehand, before the actual surgery begins. So the dentist is well versed what type of implant system he is using, how much would be the depth, how much would be the width, and how he's going to go about with the placing the implant. With guided surgery, the precise position is now acquired, the precise angulation is acquired, and the complications have reduced. That's why I feel computer guided surgery has reduced the time for the surgeon.
Okay. What would you estimate the additional cost to be to fabricate a surgical guide, let's say, for a 2 or 3 implant case in India?
I think it's somewhere around 10,000 Indian currency for 2 to 3 implants.
No, actually, hi Michael, this is Deep. Hello, can you hear me?
Yes, we can hear you. Do you want to introduce yourself to everybody who's listening?
Actually, the fabricating surgical guide, we are right now offering the guide for just fabrications only. That is cost 3,000 rupees in Indian currency. That is $50.
Okay.
And for that is for single implant side, and for the additional implant we charge 1,100 rupees implant, I mean.
Okay. And that would be for printing the surgical guide.
We are utilizing we are associated with the many stereolithography 3D printing machines, and we have also in-house fabrication systems in FDM fabrication systems in-house.
Okay. Dr. Jaju, a question came in. Can flapless surgery be planned with the software? I know you mentioned that earlier, but can you summarize that again?
Yes, we can definitely do a flapless surgery with this case. In fact, the case which I did in Bhopal, we were initially planning a flapless surgery. Just because the condition of the mucosa was not fine enough, we had to go for bone supported guide. Otherwise, we were going for a mucosa supported guide, which would have been totally flapless.
Okay.
So, and
yeah.
No, go ahead.
A follow-up question is, how do you usually cover the implant in case of a flapless surgery?
I didn't get you, sorry.
How do you usually cover the implants in case of a flapless surgery? Do you use a healing abutment, a provisional restoration?
Yeah, actually, these cases are completely planned by our professionals that dentists we are associated with. They review the cases and do the implant plannings. So just dentists, actually clinicians used to send us the DICOM file, and we forwarded the cases to our clinicians who are experienced, 36, 35 years experience in. They handle the cases. Yeah.
And once, Dr. Jaju, once the implant is placed using a flapless technique, do you put a healing abutment on top of it, a provisional restoration? How do you usually handle that?
I think we have to put a healing abutment. So basically, I'm a radiologist, but whatever I have gained from planning surgical guides in this, I think this is what is going to be there. There has to be a healing abutment that has to be placed.
Okay. That took care of the current questions. If last chance to enter any additional questions, I'll just make a few comments that I made at the beginning. Please make sure to enter your details into the webinar attendance form so that we could send you the CE credit. The link to the form is on the top of the chat screen next to the video window. Okay, this webinar presentation is part of a webinar series that's been running since beginning of 2017. the recordings for the webinar series are available on YouTube, and we have a schedule of additional presentations that will be coming in the upcoming months. So we do recommend to check those out and to stay tuned. We also send out software updates usually 2 or 3 times a year. The updates, just like the software, are available at no charge, and the software could be downloaded directly from BlueSkyBio.com. Okay, another question that came in now regarding the course. Will I be able to fabricate the surgical guide on my own after taking the course?
I think Sudeep would be in a better position to answer this.
Okay, so you could contact Image 3D Conversion with additional questions or specifics regarding the course and what's going to be presented. There's also a fantastic Facebook group called Blue Sky Bio Academy. If you search for it, there's a great community there of doctors who are posting cases and sharing information about BlueSkyPlan and guided surgery. So you can look for that. That's Blue Sky Bio Academy. It's a great resource as well. Okay, Dr. Jaju, I'd like to thank you for putting together this presentation and for your time. And I'd like to thank Image 3D Conversion for organizing the logistics of this presentation as well. And the recording of this presentation will be available on YouTube for anybody who would like to rewatch it or to share it with anybody else as well.
Yeah, thank you, Michael. It has been great interacting with you and the entire team of Image 3D Conversion.
Okay, and thank you everybody for attending. Enjoy the rest of your evening or the rest of your day.
Thank you.
Thank you, Michael.